Hello, and welcome to Beyond COP26, Next Steps in the Fight Against Climate Change, hosted by none other than Harvard T.H. Chan School of Public Health. My name is Eric Christian Olsen. I'm an actor, a writer, a producer, and I'm a host of the Harvard Chan Sea Change Real Science series. What is that, you ask? It's a great question. We connect scientists and celebrities to bring conversations about climate equity and health to new audiences. But more importantly than all those things, I'm a father of 3 and a husband of 1 and a concerned citizen who knows that strong climate action is needed now to keep our families healthy and safe. And I know what you're thinking. You're thinking, why is the scruffy Martin Atticus Deeks, special agent from NCIS Los Angeles, why is he at a Harvard event? Well, I cannot sit by and let my children inherit the projected future. So, like many of you, I was glued to the news coming out of United Nations Climate Change Conference, also known as COP26. And the announcements made there will define our course of action over the coming decades to address climate crisis. And there were some incredibly exciting commitments that have the potential to make meaningful change. And the final agreements included sticking to the goals of the Paris Agreement to limit warming to 1.5 degrees Celsius, phasing down unabated coal, and ending fossil fuel subsidies. How, people, are we still doing fossil fuel subsidies? It blows my mind. And more than 100 leaders committed to halting and reversing forest loss and land degradation by 2030. Over 100 countries signed on to a global methane pledge to curb health-damaging emissions by 30% by 2030. And for the first time, which is unbelievable, health was a key issue, with dozens of countries committing to develop climate-resilient and low-carbon health systems. So what does that all really mean? Well, that's a great question, and that's why we're here. And I'm honored to be part of the event to dive into the key takeaways from COP26 and discuss what comes next in the fight for a healthier future. And to break all of this down, because it's complicated, we need help. Somebody grab my hand, somebody pull me through. We have an incredible moderator, Stephanie Abrams from the Weather Channel. We have Dr. Renee Salas, it's an ER doctor who is fighting to make climate part of every medical conversation. And we have Jeff Nesbit, a communications expert who has been instrumental in getting climate change onto the front pages of major media outlets. And they've all just returned from Glasgow. And we have Mohammed Ali Pate, which is the former Minister of Health in Nigeria and a professor of public health leaderships at Harvard Chan School, to provide an important and necessary international perspective. So with all that, I will kick it over to you, Stephanie, with great appreciation and with thanks. And I celebrate everybody here because you're here because you care, and that's the only way forward.
All right, Eric, I have to say, thank you for that energy and that passion to kick everything off here. We're going to try to continue that all the way through this next hour. Hi, everyone. I am Stephanie Abrams, a meteorologist at the Weather Channel, and just delighted to be here 2 weeks after being in Glasgow for 2 weeks, I should say, for COP26. First, I want to thank very much Harvard Chan's Climate Center for Climate Health and the Global Environment and the Harvard Chan Studio for co-hosting this event with the Weather Channel and with Pattrn. Now, after our panel conversation, we're eager to get your questions. So we want you to email them to us at theforum, THEFORUM, at hsph.harvard.edu. I'll say it again in case you want to write it down, or no one writes anymore, right? We just type it in our phone in our notes. Theforum, THEFORUM, at hsph.harvard.edu. So that's where you can send along your questions. And just to give you an idea, this was my first COP. And so I know many of you have not had a chance to go to a COP. I just kind of want to give you an idea of what it's like. And essentially the main area, the blue zone, where you have all the heads of states and all the big conversations happening, it's just this massive conference hall. And when you're waiting in line to get into this conference hall with all the different rooms and the different pavilions representing countries and different organizations, they were handing out tea cakes. And we just fell in love not only with these tea cakes that were marshmallow and chocolate, but also these caramel logs, which was just delicious. But I bring this up because not only do we fall in love with those and bring them back for our team, we were walking 15 to 18,000 steps a day. That's how huge this conference is, just to give you an idea with the amount of steps that we were doing. So what I want to do now with all those steps is show you some of the things that we walked through at COP26. So here's a look behind the scenes. In 3, 2. Hi guys, Steph Abrams here, and I just wanted to give you a behind-the-scenes look of what it was like to be at COP26. We are joined now by Gina McCarthy, who is the White House National Climate Advisor. So good to see you. With Secretary of Transportation, Pete Buttigieg.
We're so glad that the U.S. is here to lead.
So he's told me he's walked by Secretary Granholm
3 times. I've not seen her once.
Stephanie Abrams keeps asking me, how do I keep running into you? You saw Al Gore, though.
I did see Al Gore. I think that we can track emissions around the world. What's a better way to do that? Thousands of young climate activists staged a Fridays for Future protest, marching through the streets of Glasgow. Another long neglected voice being heard at COP26 is that of Indigenous activists. Their communities are often among the most affected by climate change. Yeah! Welcome back to our special coverage of COP26. I have to say, the atmosphere here in Glasgow, it's actually pretty hopeful. So how do we hold countries, including ourselves, the United States, right, accountable coming out of COP?
Naming and shaming will be a large part of people not wanting to be on the wrong end of this stick.
Ta-da! That's done. So what we want to do now is just hop right into our panel. And I use the word hopeful. It really did feel hopeful there when we were in Glasgow and talking to so many people across the board. And I want to start off with a lightning round question and talk about the most important commitment coming out of Glasgow. I want to hear from each of our panelists with just one sentence. Renee, we'll start with you. What's the most important commitment coming out of Glasgow?
Well, thank you. And I think it's 51 countries committing to the COP26 health program.
All right, that was easy enough, Renee. Thank you. Now let's go to Mohammed in one sentence.
I would say barely keeping the 1.5 degrees centigrade aspiration was a good step, not good enough, but it was an initial step, at least, to keep that alive.
I'm very impressed that you guys really did that in one sentence. Let's see if Jeff can also do it in one sentence. I know he's very passionate.
And the methane pledge, it's going to buy us 10 years of time.
Wow, that's 10 years time. Let's hope so, Jeff. Let's hope it does. And we'll talk about more of that in a little bit. Now we're going to do another lightning round here. I want one word to sum up how you're feeling about the global prospects for protecting the planet in the wake of COP26. After you give us that one word, again, just one sentence on why you chose that. Mohammed, we'll start with you.
It's uncertain because the fundamental injustices in the global system are yet to be fully addressed in terms of who emits and also who bears the brunt. And the biggest emitters are not paying the price.
And we are definitely going to talk more about that also coming up in this hour. Jeff, how about you?
Alive. We're still alive. 1.5 is alive. We're still alive. We've still got a shot at 1.5. We've got a lot of work, but alive. We're alive.
These are all good. All right, Renee, how about you?
Resolute. The health community is a sleeping giant and we are waking up. We know what needs to be done and we are not going to rest until we have the optimal treatment we need for our patients and our communities.
And we are definitely going to dive into that because that was a big conversation at this COP26. We'll do that a little bit later. But I must say, and you guys might agree, accountability, I feel like was a buzzword throughout all 2 weeks. And we're talking about accountability in several different sectors. So let's talk about that issue. You had all these nations and industries standing up at these podiums, making sweeping promises. But of course, will they live up to them? That's what everyone wants to know. And everyone says year after year. Jeff, I want a few thoughts on how you're able to assess the reality versus the rhetoric.
So I'm going to start accountability with the really impressive media coverage. The Weather Channel, you all, Bloomberg Green, the New York Times, Sky News treated this like it was the Super Bowl. It was awesome. Bloomberg Green had updates every 30 minutes about what was transpiring. That is actually accountability. So we actually are counting on the media to hold world leaders and governments and corporations accountable for what they pledge. And I'm going to focus on the methane pledge because I was super excited. I spent a lot of my time with the methane pledge. The satellite coverage and the accountability, media accountability, and others is going to name and shame and hold industry and governments accountable. That's why I feel fairly confident we're going to actually reduce methane 30% in the next decade from existing levels that'll save us 0.2 to 0.3 C. That's my version of accountability. And I think we have a real shot at that.
So how can people that are watching this, get the data to then hold other people actually accountable for it? Because that's kind of what we need, don't we?
It is. And actually, that's one of the things that we actually had, and I have to say the methane pavilion was a white hot place to be. All the Democratic senators did their stand-ups from there. We were in the shadow of the Russian pavilion. I mean, there was a double-decker Russian pavilion. Russia, by the way, did not sign the methane pledge. We're still hopeful they will. But they would look down at us like the entire time we were doing all these events. We had satellite CEOs talk about how they're all working together to hold industry accountable. Literally every methane emission on the planet right now, we can see. We can see from space. It's going to show up. I'll predict right now, a lot of that's going to show up in the Weather Channel. It's going to show up on broadcast coverage. So we'll be able to actually see who's lying, who's not, who's cheating, who's not, who's fulfilling their pledges, who's not. And I'll start with ExxonMobil. All during the COP, ExxonMobil ran millions of dollars of ads saying, we're all in on the global methane pledge. They were in Politico, Punchbowl, you name it. Well, they're going to be held accountable through, but if they say we're going to cap wells, we're going to patch pipelines, we're going to capture flaring, we'll know, actually. And I think the public will know.
I feel like methane's having its moment. It's kind of like, if you will, like the new kale. I feel, like kale had this huge moment. Now methane's having this moment. So why is it that methane is getting so much attention now, all of a sudden out of the blue? I feel like it's all been a CO2.
Yep.
And now all you hear is methane.
It's so funny. We named the pavilion the methane moment. So the pavilion was called the methane moment. By the way, it is an extraordinary story. Once everybody realized, oh my goodness, with satellite coverage synced up with the ability to understand where methane is coming from, we can legitimately reduce the super pollutant and do something, very rapidly that will buy us some time. The methane literally did have its moment. And I'll tell you the story. If you talk to the EU negotiators and the US negotiators, they went from 9 countries to 40 countries in about 4 weeks. And then they exploded from 40 countries to 103, literally in 4 to 5 weeks. Everybody realized, oh, this is a moment. We do have a shot. And they signed up like crazy. So that's the good news. The hard work now begins. What does that translate into? And philanthropies have stepped up. I mean, philanthropies, said they were going to donate $300 to $400 million to do some of this accountability work, some of this communications work, some of the hard policy work, some of the satellite coverage. So it had its moment. It all came together in a very rapid fashion.
One more quick question for you, Jeff, on this. There's a lot of companies saying, oh, well, this is just going to make consumer prices go up. Is there a way to avoid that? Should the companies be, taking on that cost?
Well, I can tell you all of the oil and gas industry majors have said, and take this with a healthy dose of skepticism. They've said they can do all this and there will be no net cost. They say they can reduce, do all this work and there will be no net cost. So I think that needs to be part of this accountability question. If they say we can do this, 50%, we can do this with no net cost, great. There should be no net cost.
Yeah, that is definitely something. That's a real one that people want to keep track of there. Jeff, appreciate that. Renee, let's talk about another commitment made in Glasgow. A pledge from more than 40 countries to green their healthcare system by cutting carbon emissions. Now, I don't know if everyone knows, I was actually surprised by this number, that health systems are actually a significant source of greenhouse gases. In the US, responsible for 8.5% of our emissions. So this is a real important step, but the pledge was short on specifics. So I'd love to hear from you what steps the healthcare system needs to make to take down that number and how we can hold them accountable. So maybe we start off with, what is so bad about the healthcare system when it comes to the greenhouse gases? What's the worst offender?
Well, look, we are in the business of taking care of patients. Our mission is to improve the health of our patients, accelerate equity, and prevent harm. So we as a healthcare system cannot be contributing to this vicious cycle of thus producing more greenhouse gases. It's driving climate change, which is causing health issues, in addition to disrupting our healthcare systems and air pollution. So this is a really huge moment because it, again, is showing that the healthcare system is waking up. We are recognizing that we have to take care of our house first. But I think more importantly, we can use this as a powerful lever to really knock down dominoes across so many other sectors.
So what are some of the changes that can be made in the healthcare sector?
Yeah, so I think we make the diagnosis first, right? And then you have to, which people did, they made the diagnosis and committed to this, but now we really need evidence-based treatments. So in medicine, right, we track by numbers. We measure your blood pressure when you go to the doctor. We check your labs. If you're a diabetic, we track your glucose. So we have to track these very same things, and that's reduction of carbon. So how much are we reducing carbon? And how are we actually improving health outcomes? So the way that the COP26 health program is set up, they actually listed a few steps. And the first thing is to set a target date. And in fact, 14 countries actually set net zero target dates between 2030 to 2050. Now, the NHS has been leading the way, and actually over the past year, when they committed to going net zero, they were able to reduce emissions by over 1,200 kilotons of carbon, which is equivalent to 1.7 million flights between London and New York. So they are leading the way, but we need to thus figure out what the baseline emissions are, and then actually develop an action plan and a roadmap that allows us to measure in a tangible way that's accountable.
And there is a huge connection that people might not think of. And you were telling me a story about patients that you sometimes have to convince your patient that climate is the cause of their illness.
Yeah, so it's connecting the dots, right? And it's, when I think about it, when I'm in the emergency department and I see a patient who has asthma, and in fact, they're having problems with their asthma because pollen levels are higher because of climate change. So here I am, I'm pulling patients sort of out one at a time from the river, but I look behind them and I see so many more behind them. So what I need to do is actually walk upstream and figure out what's causing my patients to fall into the river in the first place. And that's where we find the burning of fossil fuels. And that's the connection. That's how we show people that how action upstream and action on climate change is actually a prescription for improving our health today, in addition to accelerating equity.
And real quick here, are there greener products that can be used in all of healthcare? I mean, this is a tough one, right? Because you can't share. I mean, I know you can, wash some stuff if you will, but is there a push for these greener products? And what are those exactly if there is?
Yeah, so I think about so many things that we have labels for, and they're actually one at COP, right? There can be labels for how much carbon how carbon intensive food is. So we can do the same thing for medical products. So we can actually incorporate that into decision-making. And there's different endeavors that are happening right now, like in the US with the National Academy of Medicine launching an action collaborative on healthcare decarbonization that are getting everyone to the table to really figure out what these levers are and how we can move things. And for example, put labels on, so that way we can recognize how carbon intensive things are.
Well, no discussion of accountability is complete without talking money. And that was another huge discussion here at COP. A decade ago, the world's richest nations promised that by 2020, they'd be channeling $100 billion a year to low-income nations most affected by climate change to help them adapt and mitigate future risk. And remember, as Mohammed mentioned, and I'm going to get to you in a moment here, Mohammed, these countries that are feeling the worst effects are not the biggest offenders when it comes to greenhouse gases here. Of course, this promise has not been fulfilled. We're tens of billions of dollars short. So Mohammed, I want you to talk more about this in the developing world and countries such as your native Nigeria. What resources are needed most urgently?
So we're living through a 1 in a 100-year pandemic, and we're seeing the state of the world in terms of how it's responded to that and the inequality between countries and within countries. That's a small test case compared to the impact of climate change. Many developing countries in Africa, in the Sahel, with lots of population, for them, the impact of climate change is real. It's today. It's in disrupted food systems. It's in polluted waters. It's in all ramifications, in addition to there's a worsening poverty as a consequence of that. And we're seeing the world fall short in terms of mounting the response that is needed to adapt. And that is a reflection of lack of really global leadership. And we've seen it in the COVID-19 pandemic, where countries looked at themselves, each individual country by itself, rather than the collective. And we'll survive this and we'll deal with it if we approach it as a collective global community that takes into account those who are poorest and most vulnerable in our societies. And that will require really informed global citizens all across the globe. And our education systems also nurturing those leaders that will emerge and see this as a global commons challenge that needs to be solved. Otherwise, I think we'll have a long period of difficulties, particularly for the poorest people in our planet.
And what do you think some of these countries need? Is it strictly money? Is it the technology? What really is needed?
I think the resources are needed. We saw the modest contribution that were announced, but that's too insufficient for dealing with the crisis that is already unfolding in many countries all over the world. So the resources are a good start. It's a conveyance of the will of the global community to adapt, to help countries deal with the consequences of it. But the system, the community systems, to really deliver the basic services, to have the surveillance systems that anticipate some of the consequences, whether it's newer infectious diseases or outbreaks of diseases that are as a consequence of climate change, and to be able to deal with them and have trusted relationship with the people. So countries themselves ought to have the policies and the plans to be able to deploy those resources. Today, for instance, in Nigeria, a climate change law was passed to try to streamline and codify what is coming out of the COP26. That's a good start, but I think it needs to have global leadership, the resources from the wealthier countries who are really behind much of the change that we are seeing, and countries themselves then have to take necessary action in terms of their policies, their execution, and linking to their populations so that we emerge out of this, or at least survive together as a human civilization.
Let's talk about some of those consequences. You mentioned disease a little bit, but food and water and, people having to go much farther in order to get food and water. So maybe you can give us an idea, besides just the water rise, right? A lot of people, the Tuvalu minister showing the water rise and whatnot. What are truly some of the consequences for these smaller nations?
So after traveling in the UK, I came to Nigeria and I flew over farmlands where there were produce that were left on the farms. And reason, the climatic pattern and the rain pattern has changed such that the produce were, flooded at a very difficult time in their cycles and led to food wastages. And that will have consequences in terms of the nutrition and food security of the population in this area. That's a consequence of climate change. But the folks that are bearing the brunt of it are really not as well prepared to deal with that consequences. So whether it's new seeds, whether it's new technologies to enable them farm in ways that sustain their food production due to the changes that are ongoing, are all key part of building that resilience in the world that we're going into with the continuation of the climate change that we're seeing.
Jeff, let's talk a little bit more about this money, because I don't know if a lot of people know how you have to go dirty before you go clean, if you will. We'll start with that. Can you explain to everyone what that means exactly?
So you've got to cut. Let's start with the Green Climate Fund and the $100 billion pledge. It's not up to $100 billion. They got closer in this COP. They got up between $80 and $90 billion a year with a pledge that they'll finally get to $100 billion probably within a couple of years. We'll put that off to the side for just a second. One of the other really big important discussions that occurred at this COP that I was super excited to see was they finally got into a process where they described, okay, how can dozens of these countries that ordinarily aren't going to get access to this money, how can they finally have a real conversation about how they can get access to this money, whether it's for loss and damage, which is to cover the potentially catastrophic costs that are occurring in these countries, or adaptation. How can you adapt to things? And just to use an example, every single country that's in the subtropics, and the easiest way to think about this is if you go around the equator, countries that fall on either side of the equator are now experiencing water stresses, potentially catastrophic water stresses. Northern China is around the Gobi is experiencing stresses. The Sahel region experiencing water stresses. You add then on the top of that, you add the weather patterns changing, rainfall patterns changing, growing seasons either shorter or longer, creating uncertainty. You're going to have countries with very little resources not able to meet these challenges. The way the system works right now under the Green Climate Fund is you've got to have a dirty energy system before you can get access to money to clean it up. That needs to change, and that discussion began at this COP under the loss and damage facility question. I was delighted to see that conversation begin. It's going to, and it will have to culminate a year from now in the next COP, which is how can these countries that don't have a dirty energy system, how can they get access to this money right now so that they can just go simply from, basically one system to a clean energy system without having to go through a dirty energy system in the first place.
And it's not only that, there are countries that are in between, if you will, and they also need some help. So how do we figure that part out of this whole financial stuff?
That's why the loss and damage discussion was so critical. And at the end of the COP, I mean, you sort of saw it in the last few days, everybody had been pressing for a facility or a fund or something. But what everybody really wanted, and some of the big coalitions like AOSIS and even the Group of 77, there are lots of coalitions that sort of band together to have a collective voice at these COPs. They finally said, look, what really matters is the process. It has to be transparent. The money has to be there. We have to have the ability so that the money doesn't go to a handful of even the bigger developing countries. It should, all the countries that are under stress right now, they need a process that's transparent, that they can get access to this money. That conversation really began in earnest for the first time at this COP, and it was really exciting to see.
And Mohammed, talk a little bit more about that. There was also a lot of conversation about loans versus grants and how, these countries don't want loans. They just need to be given money. So how does that all flush out?
I think at the end of the day, it's really about making the resources available, doing so transparently, as Jeff mentioned, and for them to be used to reach the communities that need to respond to the challenges that are facing. So grants are better, given the debt crisis in many countries. So that's an important part of it. And I believe that concessional financing also can play a role for some of the investments that are needed. So it's really going to be a combination of both, but countries will prefer the grants more than loans.
That they would. All right, Renee, let's talk more about health and the impacts of climate change. This was the first year that health took such a high profile, it was so high profile, I should say, at the UN Climate Summit. There was a health pavilion, there were events for the US main stage, a day-long conference from the WHO, and many speakers that provided moving stories. Renee, you're truly one of the leading experts when it comes to health impacts of climate. And I'm curious what you took away from this focus and what was achieved.
Well, we have nowhere to go but up. So we have seen enormous momentum here, but I can promise you this is just the beginning. So I think I've only been home for not even 36 hours yet, so I'm still processing. But I think one of the most amazing things and inspirational things for me was sitting around with colleagues from around the world, and we're sharing stories, and we all have common stories. Our patients and our communities are being harmed, and their health is being harmed today, here and now. And obviously it varied depending on which geographic region you're in. It varied for our patients, depending on what their job was, what their income was, what the color of their skin was. But we were unified in this common bond. And I think that was enormously powerful. There were more health professionals there than ever before. And as you said, there were more events than ever before. So this is important, but I also think that we have an enormous potential to move to make sure that health and equity are integrated into all of the conversations. I mean, this needs to be a thread where we not only have our own events, but health and equity can actually be the drivers for not only why we need to act, but also help guide the response.
And is climate change becoming an actual diagnosis now in the healthcare industry?
Well, it is for me in my patients. I think there's something called a secondary diagnosis, which really is just something that makes it harder to prevent the development of a primary diagnosis or to manage it. So for example, again, I think asthma is something people can understand. So you come in with an asthma attack to my emergency department, right? That's your primary diagnosis. But yet, as I mentioned before, climate change is driving pollen levels to be higher. So it is actually a secondary diagnosis because it's making it harder for me to treat my patients. So sometimes I feel like I'm putting literally a Band-Aid on a bullet wound because I can try to open up the airways and manage that asthma attack, but I'm sending that patient right back in that same environment. And so we have to make the diagnosis. And once it's made, we recognize that the treatments are a little bit outside of the toolbox that I learned in medical school or residency. And once that toolbox is identified that it needs to be different, then we see we have to walk upstream, get to the burning of fossil fuels, and that is the treatment that we need to enact.
And Mohammed, I was wondering your perspective on health and climate and these developing nations, and what type of effects it's having on the people, and if they're even able to get treated.
I think the effects at the population health levels, I think that you can easily see, whether it's in the food system that have been disrupted and the undernutrition, particularly among children, women, and whose sources of livelihoods have been taken away, or in terms of outbreaks of diseases like cholera, typhoid fever, because of flooding, displacement of populations that is occurring. And I think those also affect their mental health. Those are population level changes occurring in populations in many poor countries. At the care level, I think there are deficits in basic healthcare, in primary healthcare, in community health systems that, of course, need to be filled, even outside the issue of climate change. And that's an ongoing effort that the world would need to contend with in terms of getting to universal health coverage. That's a basic.
All right, we want to bring now back to some domestic politics. The Weather Channel, of course, we've been reporting on, these 500-year floods and excessive heat waves, wildfires, bigger hurricanes, stronger hurricanes. Yet, as the Biden administration tries to deliver more than $550 billion in climate funding through the Build Back Better Act, a new Washington Post ABC News poll found that a third of American adults still don't see climate change as a serious problem, and the partisan divide is growing. Just 39% of Republicans say climate change. 39% of Republicans say climate change is serious. That is actually down 10 percentage points from 2015. So, Jeff, you're a communication strategist. What are your thoughts on how we can, rally behind climate change? And does COP26 change the political dynamic one way or another?
Let me break this into a couple of places. First of all, I worked in a Republican White House as a communications director to a Republican vice president, and I can tell you it saddens me beyond belief that climate has now become a partisan issue for Republicans. I think it's changing somewhat. And in fact, there was a Republican congressional delegation that came to COP, first ever, more than a dozen Republican members, but they are in a very tiny minority inside of the Republican Party. So that's part of the problem. I will just say that the polling that you just cited on the Democratic Party side and the independent side, everybody gets it. It's like 95 to 98% of the registered Democratic voters consider climate change either one of their top three priorities, and for independents it's pretty high as well. It's just the Republican Party, and it's become just like the question of vaccines, masks, evolution in schools. It's become a party ID issue for them, and that's driving the partisan nature of this issue in the United States. All of that being said, I will tell you, we've seen a dramatic change in just the last 3 years. One, the artificial climate science debate in the media, gone. It's completely gone. You don't see any of that anywhere in any media coverage ever. And that's actually had an effect on the Republican Party politics in the United States. They don't want to talk about the climate science stuff anymore. That's gone. Now it's all about cost. So what you're going to see in the Build Back Better debate that's going to occur, I think a vote will occur either tonight or tomorrow in the House. And we had some House members there who spoke on some panels, including AOC and Joe Neguse and some others, who said it's going to pass the House. The moderates and the progressives they've come together. Then the question becomes, will Joe Manchin in the end vote for this bill when it gets to the Senate? One of the things what I predict you will see is an intense debate over the cost of this Build Back Better when it comes to energy prices, gas prices, energy prices. It's a tried and true talking point that gets demagogued to death in these sorts of big policy debates, and I think you're going to see that again shortly.
Mohammed, is there as much of a divide around the world, would you say, or is much of the rest of the world on board with climate change being an issue and believing that humans are causing it?
I think the understanding itself needs to get much further beyond just global political elite and power elite. I think citizens need to appreciate the science, but also the impact that it's having in day-to-day lives. I think that's still an area that work has to continue over time so that we approach it from sort of a collective with the engagement of people all over the world.
All right, Mohammed, we're going to stay with you. And I actually kind of want all of you to answer this, just thinking about the next year. Shifting back to that global perspective, COP27 will be held in Africa, specifically in Egypt. Mohammed, I'd like to ask you what topics you expect to be high on the agenda, and also what we need to accomplish in the next year to lay the foundation for success.
I think we should expect to see more on the resiliency and adaptation side. I think the finance aspects will also be thrashed. I think the countries will need to work from now until then in terms of their own plans, the ambitious plans to adapt and respond. So I think the sense of urgency should be maintained, and the engagement of citizens and the people at the center of this agenda will need to continue.
Renee, what do you think about this? What really needs to be done in this next year?
Just to pick up some of the themes that have been discussed, the connections with health make climate change personal. And it shows that it's impacting us here and now, and will actually improve our health now, especially by improving air pollution. So we need to continue to make those connections because the health messages work, and health professionals are trusted messengers to deliver that connection to people where they are, by their local providers, by their local public health departments. So we need to continue to do that. And we need to make sure that health has an even more prominent stage at COP27 and that it's actually incorporated throughout discussions.
All right, Jeff, before we get to you, Renee, what did we learn from COVID and climate change? Because there was a lot of talk of seeing, you mentioned air pollution. That's what I thought of this. All that air pollution went away real quick, but of course came back real quick as well. What did we really take away from COVID?
So there are numerous parallels, but I think a really prominent one is the fact that when we fail to act, and when we fail to act quickly, it causes inequitable health harms and people die. And so we have seen that on an accelerated stage here with COVID. And so we need to make sure we don't replicate that on the longer timeline with climate change. But I think more importantly, it's shown us how quickly we can change. My hospital has done more during this pandemic to change the way they do things than ever before. So we just need the appropriate motivation and necessity and urgency and resources, and things can be done. So we can do this. And I'm even more confident now seeing what we've done during the pandemic.
What were some of those changes?
So for example, telemedicine. So things like this, you can actually talk to a doctor now even easier by using virtual technology. And oftentimes you don't have to actually go in to see your doctor if it's a medication question or other things. So that allows you to stay at home. And it also prevents you having to drive in or potentially increase your carbon footprint to get to your doctor. We're also looking at how to sort of shift care to the home. So how can we actually try to provide care to people where they are, like ambulances and other emergency personnel that can actually provide care in the home itself, which can keep people out of the hospital and sort of lower what we need for resources. And those are just a few examples.
All right, Jeff, what needs to be done in the next year as we head to COP27?
So I'm going to focus on three things: coal, NDCs, and pipelines, and I'm going to explain what each of those means. So first, take coal. There was a really explosive debate at the very end of COP over phasing out coal power or phasing down coal power. India, right at the very end, withheld its vote to ratify. You need all 197 countries to ratify the language in COP, and said unless they changed the language from phasing out coal to phasing down coal, they weren't going to sign on. And it actually brought the COP president, Alok Sharma, to tears when that happened. And nations stood up and said, this is abominable, but nevertheless, they wanted to get it passed. But that debate over coal, as Mohammed and Renee can tell you, we now know that the health and equity benefits from not building new coal plants and instead just building solar or wind plants or renewable energy sources is pretty clear. We know there are health benefits from that. And that is a clear direction that we need to go in. So that taking that language, phasing down coal, is going to carry forward in the next year, going to the next COP. The second is the question of pipelines. If you've got a methane pledge and everybody's pledging they're going to patch these pipelines or not build them, or especially not build them near population centers, well, I can tell you the fight over the East Africa pipeline is a big deal, and it's going to be front and center in the next COP. You now have satellite surveillance that can show very clearly where pipelines are being built and how they're going to carrying fossil gas or fossil fuels around and near these population centers that has health questions around them. That came up for the first time in this COP. And finally, NDCs. And what NDCs are is individual countries voluntarily commit to reducing their emissions collectively. Not very many countries came to this COP, the COP26 with increased pledges. So for that reason, one of the outcomes of this COP was that people agreed we need to come back sooner with better NDCs, better national targets, reducing emissions. We're going to have, and basically the next COP in Africa, we'll see if countries do agree to finally come back to the table with better emissions targets. Those are the three of the bigger fights that I see in the next year.
I want to get to your viewer questions, but Jeff, I neglected to ask you when we were talking about methane, why it's gotten its moment and everything. And I just want to give everyone that's watching that maybe might not know, you said that methane, if we take it out, that could save us, 10 years or so. Explain just real quick why that is, and then we'll move on to viewer questions.
So unlike carbon dioxide, was staged in the atmosphere hundreds of years and is a greenhouse gas. Methane is also a greenhouse gas, and it's produced from a variety of sources like industrial waste or in the cattle production process, but also in the oil and gas process. It's flared, it leaks from pipelines, or there are hundreds and thousands of orphan wells that were drilled where methane is still leaking. So if you can, and methane stays in the atmosphere tens of years. So there's studies, very recent studies that came out of this COP that showed about half of the warming that's occurred on the Earth since the dawn of the Industrial Revolution is from methane. So if you can reduce methane, and a 30% reduction from current levels is a big cut, but it's doable potentially without a cost. That's the studies show you can save a degree of warming Fahrenheit, which is a really big deal. So when I say it buys us 10 to 15 years, that means it keeps 1.5 degrees C within range. We're still alive. We have a shot at it, but that's why methane is so important, because it's a super pollutant that's responsible for half the warming to date. So if we can cut that back substantially, that gives us more time to deal with the carbon dioxide problem.
All right, thanks. Sorry I didn't ask you that above. I just forgot it, but it's so interesting to me, and that's why it's being so talked about these days. All right, let's go to our viewer questions. The first one was from talking about the very strong youth movement at the summit, and a lot of these young people, furious at our leaders for failing to take more aggressive action. And Renee, this viewer asked, how can we harness that energy for good?
They have a powerful voice, and we need to amplify it. I mean, these are our children, our patients, our neighbors. They are future leaders and future doctors, nurses, health professionals. So from the health community standpoint, we need to make sure that those voices are elevated, that those stories are elevated. And I think there's also a very powerful combination with youth within the health community, right? Those that are still in training. And I think medical students and other trainees have a really powerful voice, and we need to make sure that we continue to amplify that.
Mohammed, what do you think the youth can do?
I think the youth have an important voice. They will live through much of the consequences of what we're seeing. So amplifying their voice, as Renee mentioned, I think will be key, but embedding climate change in the curricula, in the educational systems, beyond medical schools. I think all educational curricula should sort of embed some of this so that it's a conversation about the future of our world.
We have a question from Loretta. Fossil fuels, looking at fossil fuels, how did this COP take a different approach from the previous ones? At this stage, are the obstacles to reducing fossil fuel dependence primarily political or technological? And Mohammed, I'll start with you on this one.
I'll say it's political first, because the issue of fuel subsidies is an unfortunate one that has dragged this far. And at this point, it's something that it's political leaders that will have to decide to pull out, but also to live with the consequences of those decisions that they make, because they are losers in terms of withdrawing subsidies. So I would say it's largely a political one, and also the technological bit is there, but I will say first and foremost, it's a political problem.
Jeff, maybe you can expand on this too, because Eric said, how are we still subsidizing fossil fuels? When I learned that, and I forgot what the number is, so I don't want to quote it, but it was an outrageous number. People might not realize that how do you get rid of a problem that we're subsidizing?
There are hundreds of billions of dollars subsidizing fossil fuels. That was one of the other big, I mean, it is shocking to me, and I want to get into that in just a second. But one of the other big fights was language for the first time saying, we're going to phase out fossil fuel financing. Well, sure enough, Saudi Arabia and Russia and a couple of others said, well, can we put inefficient? They added an adjective in front of, so let's phase out inefficient fossil fuel financing. And people weren't real happy with that, because what is inefficient? If you're good at subsidizing fossil fuels, then you get to keep subsidizing fossil fuels. One of the, and I'm going to actually combine youth with fossil fuel financing, because I think this is key. I think one of the things you're going to see, I'm going to predict right now, the youth movement is fierce, it's big, it's growing stronger. It's not just Greta Thunberg. She's got lots of other folks who are very sophisticated when it comes to social and digital media. They're going to turn their sights on the banks and the financial institutions and the companies over fossil fuel financing. So for instance, you've got all the oil and gas majors. It's not enough to say we're going to reduce our emissions in our own supply chain. They actually want them to stop exploring more and more to find more and more fossil fuels. And to date, the big financial institutions and banks are continuing to finance that. So you've got massive subsidies and massive financing for more exploration right at the time when when some of the big international groups, even the International Energy Agency, has said we need to stop more exploration of fossil fuels. And why in the world are these banks and financial institutions financing that? So I think both of those are going to become big topics of conversation for the youth movement and for some others in the coming year to 2 years. And you saw that discussion begin at this COP.
All right, our next one's from Richard, and Richard says, are we not deluding ourselves to think that we can stay below 1.5 degrees Celsius for a potential upper limit? The last minute softening of the commitment to eliminate coal is an indication that there's no real will among world leadership to take a stand. Renee, can we do it? Do you think it's enough, essentially?
So the emergency medicine doctor in me, views this as the equivalent of a life-threatening heart attack, what we call a STEMI. So when someone comes in with a life-threatening heart attack, we have to act immediately, and we mobilize every resource we have in order to open that vessel in that person's heart. So in my mind, every fraction of warming equals worse health and worse inequities. So we need this emergent approach. So from that standpoint, yeah, it's frustrating, right? On the fact that we're moving so slow. But then I recognize that we are trying to get all countries to come together. And, if you think about in medical school, I don't really do this in the emergency department anymore, but as a medical student, I would counsel people on better diet and exercise for people when they have heart disease, right? It doesn't take one conversation for people to suddenly go out and do exactly what they need the next day. That's a conversation. And so I try to remind myself of that and recognize we are having a conversation that is progressing, but I'm 100% convinced that we can get there because we have the treatments we need.
And Mohammed, where do you stand on that? I mean, because I know the developing nations came into this and put a lot of pressure on, the wealthiest nations to say, come on already, help us out.
If this was an asteroid heading towards our world today, would we respond in the way that we have responded at COP26? I don't think we would, but it's similar. We saw that in 2020 with the COVID-19 pandemic. Big countries, wealthy countries, scampered around and focused on only their own little bit. And I think we risk replicating that in the context of climate change, and despite the emergency. It requires global leadership, and I have to say that I'm still looking for that. And I hope that we can build on COP26 and see the emergence of that, not only in governments, but among the youth, as we've discussed here, because that will be what ultimately pushes the world to take the difficult decisions to keep within that, within the 1.5 degrees centigrade ceiling that we're aspiring for. But it's difficult. I certainly think it's very difficult.
Jeff, I saw you nodding your head, so I have a feeling
Well,
you have an opinion on this.
I do. I just have to add that there's going to be a really funny movie that's in theaters on December 10th with Jennifer Lawrence and Leo DiCaprio and Adam McKay is the director of this movie, and it's about world leaders, a comet heading toward Earth. World leaders talk to the scientists. The scientists, we got to do something, and the world leader says, never mind, we're not going to. So it's a comedy, but it's actually an analog to the climate crisis. Like the scientists have all said, this is going to kill us all. You'd better do something about it. But the world leaders say, we got other things to do.
But with that said, real quick, just as a follow-up, and just in the Paris Agreement and in all these agreements, the number is 2 Celsius, right? But we're all pushing to 1.5. So why not make it 1.5? Why is 2 still part of the conversation?
Well, I can jump in and I can just tell you, go back to the previous COP. Some of the like the Marshall Islands coalition, some others in the Paris Agreement, it was going to be 2C. Let's limit it to 2C. And then some of the others said, hey, wait a minute. 2C, we won't exist anymore. So they said we really need to try to keep it at 1.5 C. And so that was embedded at the last minute in the Paris Climate Agreement. And that's why we've had this focus on let's do everything that we possibly can, conceivably can, to try to keep it to 1.5 C. So when you hear people say, let's keep 1.5 C alive, it's a result of this successful effort by these countries in coalitions in the Paris Climate Agreement to keep the focus on 1.5 C. So that's why you go back and forth over whether it's 1.5 C or 2C.
All right, this one from Catherine and Renee, I'm gonna have you answer this one. Well, actually, let me scroll back here. Sorry, I guess from Gabby. We're gonna start with Gabby's question. What has the impact of COVID-19 been on climate finance? Are you seeing public health and climate competing for dollars, or is there a greater awareness of the interconnection between health and climate?
So when I give a treatment to a patient, I recognize that it's going to impact like multiple potentially systems in the body, right? And so we have to recognize that these solutions are actually interconnected, right? And we can rise above multiple problems at once. So whether we're trying to prepare our public health system to be more prepared for the next pandemic or for climate change, we just need to add what I like to call a lens. So any photographers out there, it's just something that you look through and you view things to understand how that's impacting that issue now and how it will so in the future. So we can add both, again, resilience to pandemics or resilience for climate change. We can add both of those lenses together and actually strengthen our response to both and rise above both problems at once. So I don't view it as competition. I view it enormous synergy.
I like that. And sorry, the chat had jumped up with a question. So now from Catherine, as I got my technology fixed here, Mohammed, I'd like you to answer this because you mentioned education earlier in the show here. What role should places of higher education play in the global effort to fight climate? How can colleges and universities do more?
I think they have an important role to play. They reach millions and millions of youth, of young people, of the future leaders of countries all over the world. So embedding research and learning on what is going on in our world today, but also the alternatives for mitigating and adapting to the changes that are occurring is going to be key. And the education sector should take that, I think, a lot more. Of course, there's the advocacy and the political leadership that also emerges from those schools. That also has to come into play for the decisions to be made.
All right, we got one from Chrissy here, Jeff, that I think would be good for you. How do you reconcile that the technology isn't yet developed enough to safely phase out fossil fuels? Look at what happened in Texas last winter as an example. And what Chrissy is mentioning is there's this massive cold snap and, people didn't have heat in their homes. And there was a lot of people that died during that event, actually.
So let's talk about Texas for just a second. So the governor of Texas immediately goes on Fox News, like right after it, and he blames wind and solar power, which was not right. It was actually incorrect, and he later had to walk it back. It was actually the natural gas system that didn't actually work so well on the grid. So it was the existing fossil fuel structure that was really at risk in Texas, and you had the Texas Commission that hadn't paid any attention to that. The truth is, a modernized grid with renewable energy and a decentralized grid with renewable energy is going to withstand this much, much, much better, and it's cheaper. Now, And yet we're still having this discussion about 19th century technology and a 20th century grid with fossil fuels. We need to be in the 21st century with renewable energy and a decentralized grid. And I can tell you, when I was at the National Science Foundation, we funded all of that. So the concept of battery power combined with a decentralized grid and renewable energy, that's the safest way to make sure you handle energy shocks and price shocks and problems like you saw in Texas. So yeah, I'm happy to have that discussion over Texas any day of the week.
All right, our next one here from Jan Mohammed. I'm going to have you answer this one. How are wealthier nations helping other countries make the shift to renewables and invest in climate adaptation and resilience? Another big talking point there at COP26 this year. What is the right balance between spending on renewable and investing in adaptation?
I think both have to go hand in hand. The multilateral financing institutions trying to do some of that through their cooperation with the developing countries. But there are also bilateral sources and private sector funding that will be needed. I would say it's not either or. We need both, and we need both aggressively in terms of the renewable energies, but also in terms of helping the poorest who are living with the consequences today.
And we have another one here. We're about to wrap up here, but this one is a good one from Adelaide. Renee, you can start with this. What is the latest agreement due to hold countries accountable for their goals and promises? We mentioned health. There wasn't, too many specifics there. What mechanisms are built to encourage transparency?
Specifically for the health commitments or just overall?
Whichever you'd like to answer.
Okay. Yeah, I mean, I think from the health perspective and for those health system commitments, there's a forthcoming effort. And so the NHS, which again was the first country to commit to going net zero by 2040, they actually have combined with the WHO to create a collaborative platform to try to help these 14 countries that have committed to net zero, again, targets ranging between 2030 to 2050, to really start to figure that out. So exactly what do these metrics of success look like? How do we actually report them? And so similar to what happened at COP26 now in regards to the transparent reporting, we need to do the same thing for the health systems.
Jeff, enough transparency? I mean, transparency and accountability, they kind of go together.
They do. And honestly, people behind the scenes, it doesn't get much coverage, but there's been a lot of work around transparency that, and in fact, you saw the carbon markets discussion of this COP was all about transparency. They don't want what's called double counting of national targets. So I can just say in the negotiation space, there's been a ton of work about making sure that things are transparent. I'm actually pretty pleased with the discussion around transparency, at least at these COPs. I don't think that's the case with the oil and gas industry necessarily, or with the financing of fossil fuels. You've still got a ton of greenwashing going on, both in the corporate space as well as the financial space. So I think transparency. I think we're in a better place with governments. I think we're not quite there yet with corporate and industry transparency.
All right, Jeff, thanks for that. And thank you all for sending in your questions. We're getting close to the end here. So what I want to do before we wrap it up is give all three of you 30 seconds to share your vision for the future, what's needed to turn the pledges from COP26 into action that will build a healthier and more equitable future. Mohammed, we'll start with you.
So I think we've had a great start, good discussion here today. And I think COP27 will be an opportunity to build on what has been started. Countries will need to have their plans, but global leadership will need to come together to finance countries to adapt to the implications of climate change, particularly the poorest countries in the world.
All right, Renee.
We have to put health central to our response, and we have to recognize and make those connections for people that climate change is a health crisis first and foremost, and that action on climate change is a prescription for health and equity. So as we make those connections and have unprecedented global coordination among the health system, in addition to within our own country here in the US, we can begin to advance that. And I believe with every fiber of my body that will help catalyze what we need in order to get the treatment we need to improve health and equity on this issue.
All right, Jeff. Thank you, Renee. Jeff, you get the last 30 seconds.
So the Glasgow Climate Pact was really two different COPs. The first week, you had these massive pledges around methane and coal and forests and finance. Now those have to become reality. So that's the first half of COP. The second half was about making sure that countries come back with better pledges, a better process for finance. That is going to be the what we're going to debate over the next year until we go into the next COP in Africa.
All right. Well, I want to thank you all, our distinguished panelists. I really enjoyed it. You guys rocked it, and I appreciate all your knowledge and sharing it with everyone. Also, of course, to actor and activist Eric Christian Olsen, to the Harvard T.H. Chan School for Public Health, and of course, you, all reviewers who joined us today. Everyone, have a good afternoon.